And what dose and frequency of injections do you use for Thymosin Alpha One?
So Thymosin Alpha One, you can inject daily if you wish. I have been using up until recently a compounding pharmacy that made sublingual tablets for dissolving 500 microgram tablets, and I would start with a single under the tongue or parked between the cheek and gum for absorption through the mucous membranes because you want to bypass the gut. It's not really that gut stable. And the sub-Q dose is similar. But then after a day or two, I'm bumping them up to about 1,000 micrograms. So they would take 2 tablets under the tongue once daily. And that would go on for 1, 2, or even 3 months. Another practitioner in Miami, Dr. Elliot Dinetz, and I co-managed a 14-year-old kid that had very, very bad Crohn's disease to the point where the surgeons wanted to remove his intestines and put a colostomy bag on him for life. His parents freaked out. He came to us for a second opinion. We determined he had Lyme disease, so we started treating for Lyme, and we used LDN, and to top it off, we used TA1 sub-Q for about a month, or I guess 2 months. He became totally symptom-free. He started to thrive again. He started to gain weight. And when the gastro guys rescoped him, they couldn't find a single lesion in his colon. And a year and a half out, he's still symptom-free. He's basically cured of his Crohn's disease. And we published that in a peer-reviewed journal as a case study, hoping that other gastroenterologists who had the braveness of looking at this literature would consider using LDN, using peptides, and treating for an underlying cause to help their pediatric and adolescent Crohn's disease population.